So this is our slideshow on mental disorders, PTSD, post-traumatic stress disorder. Post-traumatic stress disorder is included in a new category in the DSM-5, trauma and stressor-related disorders. All of the conditions included in this classification require exposure to a traumatic or stressful event as a diagnostic criterion, such as being a war veteran or being an abuse survivor.
PTSD symptoms are grouped into four types: intrusive memories, avoidance, negative changes in thinking and mood, and changes in physical and emotional reactions. Symptoms can vary over time or vary from person to person.
So as you can see, we've got a few little symptoms here. Avoiding thinking of the trauma, avoiding talking about it, easily frightened, negative mood, negative thinking, always on guard, avoiding places or activities, avoiding or having flashbacks, lack of concentration, and aggressive behavior.
PTSD is caused by an extremely stressful or terrifying event, either being a part of it or witnessing it. Most people who go through traumatic events may have a hard time adjusting and coping for a short time, but with time and by taking good care of themselves, they usually get better. If the symptoms get worse, last for months or years, and affect their ability to function daily, they must have PTSD.
A little background history of PTSD. PTSD became a mental diagnosis in 1980. Accounts of psychological symptoms following military trauma date back to ancient times, though. The American Civil War and the Franco-Prussian War marked the start of formal medical attempts to address the problems of the military victims exposed to the combat. In the Civil War, they had irritable hearts. In World War One, they called it cell shock syndrome. In World War II, they called it combat stress syndrome. The concept of PTSD really came from the Vietnam War. That's when it first emerged with that title. There is also Gulf War syndrome, and PTSD officially entered the DSM in 1980. It's the DSM 3.
Your brain is equipped with an alarm system that normally helps ensure your survival. With PTSD, the system becomes overly sensitive and triggers easily. In turn, the parts of your brain responsible for thinking and memory stop functioning properly. When this occurs, it's hard to separate safe events happening now from dangerous events that happened in the past.
And that's kind of how, the negative, the symptoms are manifesting is because your body's on high alert at all times.
The amygdala, amygdala.
Amygdala?
I can't say that word. I just look at it. I never
The
say it.
amygdala.
Yay! Prefrontal cortex and hippocampus are the parts of the brain that are mainly affected by PTSD, where or it's caused and disrupted. As you can see, there's some arrows there for the prefrontal, amygdala, and hippocampus. It's more reactive. The past becomes the present, and there's hypervigilance. If you can remember what your different parts of the brain do. PTSD affects or impacts brain activity when your amygdala triggers your natural alarm system. When you experience a disturbing event, it sends a signal that causes a fear response. This makes sense when your alarm bells buzz at the right time and for the right reason to keep you safe. Your prefrontal cortex helps you thinking through decisions and observe how you're thinking and put on all the brakes when you realize something you first feared isn't actually a threat after all. Your prefrontal cortex helps regulate emotional stresses triggered by the amygdala. So this makes sense in the sense of PTSD, where you can't really tell the past and present. And other common PTSD experiences, such as unwanted feelings that pop up out of nowhere or always being on the lookout for those threats that could lead to more trauma, seem to be related to the hippocampus, which is the memory center for your brain. Clinicians look for a constellation of symptoms for diagnosis. So they've got their multiple criteria that you have to meet. You need to have a history of exposure to the trauma or to some trauma, intrusive symptoms such as frequent flashbacks, nightmares, or intrusive memories that are affecting you, avoiding any reminder of that trauma. So, a veteran avoiding watching Saving Private Ryan because it might trigger that trauma response and its memories. Hyperarousal or hypervigilance, sleep disturbances, being easily startled, just that your brain is always in overdrive, and negative emotions and their effects, and significant distress or dysfunction. Brain scans are used to understand what happens in the PTSD brain, not to diagnose someone with PTSD. So that would not be a diagnosis.
Treatment mostly involves psychotherapy and medications. Psychotherapy helps to detach traumatic memories from the severe emotional response, changing the thoughts that lead to distress and avoidance, and helping the person get back to adaptive ways of coping with life. Medications mostly include antidepressants and help in reducing the high level of emotional arousal, allowing the person to more effectively use their cognitive and rational brain in dealing with stressful conditions.
PTSD treatment works. Those who have gone through trauma can learn to feel safe in the world and cope with stress. There are several helpful treatments, so there are options. There's no one treatment that is right for everyone. Working with your healthcare provider, you can decide which is best for you based on benefits, risks, side effects, and other preferences. There are several forms of treatments like talk therapy, group therapy if you're feeling alone in your diagnosis, and a few others. So there's some famous people that have PTSD. We got Lady Gaga there, Ariana Grande, and Dorrit Kimsley.
If you guys know who Dorrit Kimsley is, let us know because we don't know who
Right.
that is.
I hope I'm not butchering that name.
Dorrit Kimsley.
70% of adults experience at least one traumatic event in their lifetime. 20% of people who experience a traumatic event will develop PTSD. About 13 million people have PTSD in a given year. 1 in 13 people will develop PTSD at some point in their life. Overall, PTSD affects around 5% of the U.S. population, approximately 13 million Americans in a given year.
Psychologist impacting research. Terrence M. Keane, a PhD, a world leader in the field of traumatic stress, has published more than 300 articles, books, and chapters on PTSD, and his program of trauma research has been continuously funded for 37 years.
Let's go, Terrence.
Woo!